Hi, I'm Dr. Lina Rodriguez-Rosario. I'm a neurologist for Health First Medical Group. I'm originally from Puerto Rico. I went to medical school at UCC, Universidad Central del Caribe in Bayamón, Puerto Rico. After completing my medical degree, I went to University of Florida in Jacksonville to complete my neurology training. Once I completed my neurology training, I did a neurophysiology fellowship at MUSC, which stands for Medical University of South Carolina in Charleston. As a neurologist, I treat patients with multiple neurological diseases, including headaches, back pain, neuropathy. But my passion is treat patients with epilepsy. Epilepsy affects people of all ages. It is considered an abnormal brain activity where the patient cannot respond or might be confused. Sometimes they present with seizure activity, such as jerking, twitching, or convulsion. Patients can be affected because of different reasons. You can have a metabolic disorder, you can have a developmental problem, or you can even have trauma or stroke as a cause of the seizures. If somebody is concerned that might have seizures, the best thing to do is get into a neurologist to have proper workup, which will include an EEG, which is an electroencephalogram looking for abnormal electrical activity, but also images of the brain to see if we can identify a seizure foci. Patients with epilepsy can be very emotional or can develop the fear just because of having seizures. They can be withdrawn, they can be separated from their family or friends because they don't want to be seen having a seizure in front of their beloved ones. Listening to the patients, knowing what they're going through, you are able to provide the care that they need and understand what they're going through. The first line treatment for epilepsy is medication. When medication fails, we can consider surgical interventions. Surgical interventions can include vagus nerve stimulator, which is a implantable device over the chest area, which is connected to the vagus nerve in your neck, and this will send an impulse to the brain. Other surgical interventions could be RNS, which is an implantable device connected to the brain area where the seizure is originating from. If we are able to identify where the seizure is coming from and that area can be resected, we can do resective surgery. What I love most about working for Health First is that it's an integrated network where we are all working as a team to provide the best care possible for the patient.